Next up is Christi Zuber. She's the head of Innovation Consultancy at Kaiser Permanente. Working with IDEO, Christi and her team lead introduced human-centered design into an organization with more than 172,000 employees. And she's going to tell us how she did it. Christi?
Thank you very much. So design has changed my life. It's changed what I do. And it's changing the lives of the people in the organization that I work for. And it's changing the lives of the people that we touch. So let me tell you a little bit about how. So as we had mentioned in the very beginning, I work for Kaiser. So I'm actually a nurse. Shock and awe. So I'm a registered nurse. I used to do home health and outpatient surgery. If you would have told me, then that I would be standing on a stage talking to a room full of designers, I would have thought you were insane. Never imagined sort of the path that I've gone down, but have done many things throughout my career and have been really fortunate enough to have lots of exposure to different ways of thinking and working with different groups. That different exposure eventually led me to move to San Francisco during the dot-com time period with a lot of other people. And at that point, I was actually recruited away by Kaiser to come into their financial department. I've no financial background in particular, but I think they thought, seems like she could do a lot of random things, so why not finance? So I came into finance, thought I can do this, but I came into finance with a promise. I said, I will come in if you promise me within 2 years I can get closer into operations, because really my passion is caring for people. So if I can get into that within 2 years, I'll be happy to do what I can. At the 2-year mark, this kind of came about. So this probably looks familiar. This is the Nightline shopping cart video from IDEO. So at this point in time, some of our executives at Kaiser had seen this video. This was, I think, around 2002 is when they came across it and said, this is kind of interesting. Tapped on my shoulder and said, okay, 2 years, we're holding to our promise. Do you want to partner up with this firm and see what you can do with them? And I said, I'm in. So at that point, basically, what we did was pair up for almost a year and a half, what I would call kind of an apprenticeship. And there were 4 of us. So before I go into that in a little bit of detail, I don't assume that everyone knows who in the world Kaiser Permanente is. So we're the largest not-for-profit. We're really an integrated delivery system. So we have hospitals and clinics, and we have home health, and we have the insurance side, and we have physicians, and it's all in one integrated network. Very large organization. We care for about 9 million people. I've heard the statistic that about 1 out of every 4 people in the state of California is cared for through Kaiser's network. We have a lot of people that work in our organization. We have 37 hospitals, and we're actually, because of our not-for-profit status, we're also able to give a lot back to the community. So we give about $1.8 billion in community programs a year. So there's a lot of opportunity within a very large organization, but I would be lying if I didn't say that's complex. In large organizations, it's a complex environment, but it's a complex environment with a lot of opportunities because you have a lot of possibilities and places you can go and things that you can be exposed to and things that you can do within your community. So it started in 2003. This was the first project that we took on. This was looking at how do we look at a woman's experience from the time that she finds out she's pregnant until she goes home after the hospital with their newborn. It was a really fascinating moment for me. You have those kind of little nodal moments of, there's something to this. So this picture here on your left is actually a picture. We had doctors and nurses and patients sitting together in a room working on a design of some ideas. And you can see here they're doing construction paper and making things. That eventually led to what we call sort of the journey home things. Without going into a lot of detail, it's interactive, very simple, low-tech board that's in the room before a woman goes home, and the information that goes with that, where the nurses come in together and they're going through what the plan of care is for the woman while they're in the hospital. One of the things that came out of that particular project. But seeing how that came about was so unique and different for me, that quickly building to learn. Long story short, that became part of how our organization said, this is great, we want to do more of this. And so I was able to found what's called our Innovation Consultancy. If I were to have 1 minute to talk to you all and give a sense of what it's like to work as an internal design team within a large organization, I would probably just put up this slide and say it's these people that are in this picture and the wonderful things that they do. They're designers, they're skill designers. But they're also people. They're deeply human, and they bring that humanity into the work that they do. Because when you're in an internal design team, you are there. If you're there 5 years after what solution you create, to be there for questions, to be there when problems arise. You're there 10 years later. So what you create, it's sort of like you don't pee in your own pool. You know, you take care of it, you make sure it's okay. You know, if you're an internal team, you don't pee in your own pool. You know, you make sure that you nurture it and you're a part of that whole system. And so I think these people are fabulous within our organization, and I'm very, very grateful to be a part of this team. Some of the things that we do, this is a little bit about sort of our approach. I think some of these things look very familiar, so I won't go into a lot of detail, but we're trying to bring a way of talking about what we do, about how we approach design within our organization. But I think the unique thing I would say is sort of those last two boxes about piloting and spreading. We're not just bringing in creative solutions and having them try it out. We live in that environment. These are our teammates within this organization. These are our patients that we're here to care for when we wake up every morning. So getting those solutions into some sort of production, seeing if they work, measuring them, and helping to spread them in our organization is part of what our responsibility is as well. So just a sampling of a few things that we do. We were asked to look at workplace safety as an example. So what we did was when we went out and did some deeper ethnographies to understand what actually occurs in workplace safety, found that one of the breakdowns is in these really difficult conversations that deal with injuries, of trying to have no injuries in the workplace, but really knowing injuries occur and why do they occur and all the social dynamics around that. So instead of just surfacing up, here's what we learned, we actually created this interactive exploratorium that helps people go through it in an interactive learning way and have difficult conversations. So our frontline staff, our labor unions, our management, our physicians are able to sit down together and interact with something in a physical way and learn and talk together. We also do a lot of things around what's the future going to look like and what are technologies that can help to support that. But because we're an internal team, we know that at the foundation are interactions with people. And like I'd mentioned before, these conversations with people. So when we look at technologies in the future, we can't take that out of context of the people who are interacting with these technologies. So we bring in what people's needs are, what the workflows are, what the context of the environment is, and now how can technology be an enabler to help make those things easier, to help make them more productive, to help make them more meaningful. We also help to do things about creating these moments. So this is around shift change. So about 7 years ago, we first worked on shift change. And when I said, ideas that you have when you're internal, they follow you. So we changed it from, at the time, there was basically a tape recorder in a back room where when nurses would come on to the shift, they would record information about the patients, sit down together, they would listen to the tape recorded information about the patients while the patients were kind of out there doing their thing. What we did is change that so that the nurses would go to the bedside, have interactive conversations with their patients. What we learned 7 years later is just because that's a good intention and the right thing to do, we didn't create the system around it to help to support that. So we have now created the system around to support that. It's called Nurse Knowledge Exchange Plus. You can Google it and find information about it if you're interested. But I think the important thing is that we created this system, and it's not just the ideas, as I'd mentioned earlier. We have to also understand what metrics there are, because we have to be skilled at not just the stories, but the data. So we say no data without stories, no stories without data. We're responsible for helping to spread these things in our organization. We're not leaving a package behind and heading off to something. We're a part of this solution. So we also have to be skilled about how do we collect metrics to show whether something is actually making an impact or not. And at that point, if it does make an impact, we put our seal of approval and our reputation on the line, and we say, this is ready for spread. And then that's when the broader organization kicks in and things start spreading across our organization. Now, to give you a sense of scale, just since the AIGA conference started yesterday, this shift change interaction that I was talking about has happened 55,000 times since this conference started. So talk about things that are impacting. That's 55,000 conversations that are fundamentally occurring in a different way now than they were before. When we really know something is successful is when other people begin to take it, use it, and create it and make it their own. So this is just a sampling of, we have an internal magazine called Hank, and it's supported by, we have a labor management partnership. About 70% of the people within Kaiser Permanente are unionized. So nurses, technicians, pharmacists, et cetera. In this magazine, they actually highlight and have highlighted several times many of the things that we've created, and that's when you know that you've really made it, is when the people that you've created this for and the patients that they're serving are owning this. So we hear things like a nurse saying, you know, I can sleep at night because I know that I'm leaving this in good hands. I know that I've been doing the right thing. But we have a broader network around us. So it's not just us within the context of our organization. We also have a large innovation space that has been created since our group started. It's about a 37,000 square foot warehouse where we mock up new hospital designs, new technology interactions. We have an innovation and advanced technology group that looks at technology out into the future, and we bring in vendors and we partner up with them to say, here's the needs that we have within our organization from our patient standpoint, from our clinician standpoint. Help us create things that are going to help to solve for those needs. We've also created an internal ethnography program so that people can learn in very basic ways to take the fundamentals of video ethnography in particular and be storytellers so they can help to move change and help to understand what the change is going to do and how it's going to impact people. And then we even find simple nuggets. We're trying to build our capabilities. This is an image of one of the physicians that attended one of our training programs, and we taught him how to use draw your experience as a way to help engage people's left and right brains together to tell stories in a different way. So he immediately went into his exam room and asked patients, draw what your health experience looks like, and had patients, when they would come in for their clinic visit, draw their experience so that he could talk with them about, well, so I see here that you drew things around exercise and run your way to health. Tell me about what you're doing there, and so that they could have a dialogue about what their health experience actually looks like. And I think you know that when you sort of have made it from a social standpoint and in a business standpoint when you're featured in the Harvard Business Review. So this was a big monumental moment for us when our work was actually featured in the Harvard Business Review called Kaiser Permanente's Innovation on the Front Lines. And one of the quotes in there was about how we have brought innovation and design methods to give patients and their caregivers a louder voice in designing for their future. And that's something that makes me very proud. So we've done many, many things. We've had a really great journey, learning a lot along the way, and we have a very, very long way to go. But that gives you a little bit of a glimpse of what it's like being in an internal organization, and I'm really excited to figure out where we go and what we do in the next 10 years. So thank you very much.